I'm Eric Antonucci. I'm an ear, nose, and throat doctor with Genesis HealthCare system. My education has been mostly in Ohio. I did my undergrad at the University of Dayton, and then from there went south and got my medical degree at the University of Cincinnati, and then went to Detroit, Wayne State for my residency. Medicine for me just always kind of made sense. I feel like in school I felt like I liked the opportunity to learn. I liked my science classes. I liked, interacting with people, being able to help people. So when it came to undergrad, I kind of steered towards those science classes. I continued to do well with them. And from there, it just kind of made sense to take the leap into medical school, which since then I've found I've enjoyed it even more than I maybe expected I would. I like the content, and of course I like meeting all the new people that I get to through medicine. For me, the decision to come to Genesis was mainly about somewhat geography as well as practice opportunities. So I'm from Ohio. My wife and I felt that we wanted to come back to the area, and felt roughly being somewhere near to Columbus was the right spot. And then, in terms of Genesis specifically, the group with Dr. Push, Dr. Rich, Dr. Rajeski, they just seemed like great partners to have. Had a very busy practice that I could join up and hit the ground running with. So the procedures I'm doing most frequently are ear tubes, tonsils, adenoids, sort of examinations of the throat under anesthesia and biopsies when necessary, thyroidectomy, parathyroidectomy, removal and repair of skin cancers and other small lesions like that. When it comes to sleep medicine, I think there's definitely a lot of overlap with ENT. So when you look at the things that cause you to have poor sleep, snoring, obstruction while you're trying to sleep at night, things that wake you up at night, many of that comes from your upper airway. And so when there are treatments available for that, it tends to be ENT who's providing those treatments, whether that's something simple like a tonsillectomy or something a little bit more invasive with palatoplasty, tonsillectomy, pharyngoplasty, things like that open the airway wider to help sleep be a little bit easier. I think the most exciting thing about it for me is you never know exactly what the day is going to hold. I think most medical specialties are like that, but ENT is certainly like that, where you never quite know what you're going to be taking care of that day, and some of the things we do are a lot different than some of the other things we do. So I like the unknown and the variety. I also think the opportunity to help people with problems that are really affecting their quality of life is one of the best parts of this particular specialty. So I think day in and day out, that's the thing that keeps me coming back to it.